I'm Dr. Mike Milligan. We are here at the California Dental Association meeting, so there's a lot of background noise, but you need to hear this. This is important for the dentist and the hygienist, and it's really new and very important. I've got Chris Moriarty of Carifree with us here. Chris, thanks so much for being with us.
Oh, thank you. I really appreciate it.
You bet. So tell us a little bit about what Carifree is and what it will do for our patients, and a little of the history, and then the system that we've got here.
Well, absolutely.
What are we looking to do first?
Well, basically our goal is pretty simple. Okay. What Carifree wanted to do was basically promote and achieve a comprehensive arrest of decay on all available surfaces of the tooth.
Okay, so we're going to arrest the decay.
Absolutely, and it sounds like a pretty simplistic goal in terms of a dental company, but the way that we went about it was a little bit different.
Right.
Carifree basically developed a two-part system.
Okay.
The first part is running a very simple test for the patients. What we're trying to find out is whether or not they have a predominance of high acid producing bacteria.
Okay, so we're going to test bacteria.
Absolutely. I mean, it's certainly no secret in the professional world that bacteria are driving these problems, but for patients, often that's brand new territory.
Right.
So introducing that can often be one of those things that's very valuable to them to understand why they've had some of the problems that we have.
And especially if we can put it in a technological system and actually show the data and a number that will show them this. So
it's a lot. And one of the patients that we worked with actually put it very simply, where she said dentistry just doesn't have a lot of these opportunities where we can demonstrate something very objective to the patient and show them very short-term outcomes.
You said that a lot better than I just did. Okay.
So to perform the test, it's actually very, very simple. Anybody can do it in any state. It's a simple swab where we're swabbing 22 through 27 on the anterior lingual.
Okay, so teeth number, so the lower anterior is on the lingual.
Absolutely. So it goes back inside our tube.
Okay.
We bend a top capsule, releasing a couple of reagents. Goes in the top of the machine.
Right.
You snap the cap, you hit the button, it counts down from 15 seconds and you get your answer.
Okay, what's this going to tell us now?
Well, basically what we want in any patient at any point in time is 1% or less high acid producing bacteria making up that biofilm.
Okay.
What we know about that 1% is once we achieve that level, that's a healthy oral flora, and that's when we can start to expect that arrested decay.
Fantastic. Okay, so let's say that we get a good reading. Well, we don't need to do a lot.
Nope.
Do we use anything of your products at that point? Or
you certainly could. Everything's designed for long-term use.
Okay.
But one of the things on the machine, we're going to get a number, but we're also going to get a symbol. I want the patient to have an instant understanding of their situation. So like you said, a check mark that they're good. You just move right along. Things are looking great. Pat on the back.
Right.
Or they get an X.
An X that they're not good.
Exactly. That means they're above that threshold. They're above where we want to be.
If they're above the threshold, what are we going to do? We've got some products here that they can use to get down below the threshold.
Absolutely.
What is it? It's a toothpaste, a rinse, a gum, what all do we have?
All of the above. Because what we basically wanted was a one-stop shop for the patient. We wanted to provide them with everything that they need to avoid confusion.
Great.
Now, one of the things that I want the patient to understand is that their day-to-day is not going to change. Because since this is a 3-month kit, sometimes the reaction is to feel overwhelmed, and I don't want that.
Okay.
I want them to hear that they're just going to use a different rinse in the morning and a different rinse at night and come back and get rechecked.
Okay.
So what we're actually...
In about 3 months, we're going to come back.
3 months. Everything that they need, start to finish, is right in here.
Great.
Now, the biggest thing to remember about the Carifree treatment kit is we're trying to really get away from biocides, where we're just chasing that infection around the patient's mouth for the rest of their life. We certainly tried that. It didn't get us the solutions that we wanted. So we're actually trying to reset that biofilm.
Right.
So here's how we do it. Month number 1, we're using what's called the treatment rinse.
Okay.
The treatment rinse is actually designed to wipe out all existing biofilm, get rid of all the bugs, so all the patients start from scratch. We're shocking the pool. Everybody starts from 0.
So you do that in month 1.
Absolutely.
Okay, what's next?
From there, we move them over to what's called the maintenance rinse.
Okay.
Now, the maintenance rinse is where the real change starts to enact.
All right.
This is where we're actually no longer killing bacteria. We're actually just controlling the environment as that microflora reforms.
Letting the good bugs in and keeping the bad bugs out as we reorganize the bacteria.
Absolutely. That's really been essential, because when we look at the characteristics of the biofilm, it's very, very durable. And if we control that, we can get nice long-term outcome. And in fact, that's one of the things that I really reinforce to the patient. I use that word control a lot. I even joke, I'll say, there's not a whole lot of things in our lives that we can control, but what we know is that if we control this bacteria, we can control the rate of decay.
Fantastic. Okay. And then there's some other things in here.
Absolutely, because again, we want to make sure that it's very user-friendly. So all the toothpaste that they'll be using are all going to be included. And one of the other things I realize it's a little difficult to see is something called our Carifree Boost Mouth Spray.
Right.
I don't know if it's happened yet, but it very well might be the most popular thing that we make.
Okay.
Originally, it was targeting xerostomix, head and neck radiation therapy, Sjogren's patients, where you get those dry mouth where it can be very problematic. So what they do is they just take a couple of sprays as needed, boost that pH up to a 9, deliver some xylitol, keep the mouth moist, and is very, very practical.
Great.
So it kind of backdoored its way into a mainstream application where as people sip their sodas and that pH drops dramatically, take some sprays, brings that back up, and keeps them out of that danger zone where those bad bugs really thrive.
Okay, now this is all based on CAMBRA.
Absolutely.
Tell us a little bit about that, briefly.
CAMBRA stands for Caries Management by Risk Assessment, and it's easily the cornerstone that makes all of this possible.
Right.
It's very important that the patient understand the connection between risk factors and how their treatment's really going to play out over the course of a few years. Because I always joke, anybody can prevent cavities for a day.
Yeah.
We need to be able to do this for years if it's going to be truly different.
Right.
And one of the things that you're holding is our risk assessment form. Because what we're doing with risk assessment is this is what's going to be the why the patient's stuck in this loop. So what I tell them is pretty simple. We can convert the biofilm. That's something that we can do.
Yes.
This is going to be a very successful approach, but the reality is when we convert a biofilm, essentially we've only bought time. How much time we bought depends on risk factors.
Right.
So it's really two sides of the same coin.
So the biofilm is good now, but it can go bad again. So
Absolutely.
And so the risk assessment sheet here, when they come back in at that 3 months, if one, or at least once they've got a good number, now and then they have to get on this a couple of months to get the good number. We can always get the good number down below 1%, and then we use this risk assessment to see the type of maintenance that we need beyond that.
Exactly.
To ensure or to maximize the probability that we will keep that oral flora good.
Absolutely. One of the sort of areas where we really see this being a big, big part is people on a lot of medications, where that's a very strong risk factor, but it's something that the patient has very little control over. So that's somebody who, this is going to be a pretty long-term solution, where they're going to use these rinses as long as they're on those medications. So I try to use a very simple script for patients where I'll say, you know what, as long as you're on these medications, we're just going to have you use a different rinse to control that bacteria. So I want it to be very simple and very approachable.
Makes sense. What kind of a cost are we looking at? It's a wonderful service for the patient, obviously, very scientific, state-of-the-art, been around just for a couple of years now or so.
Yeah, the company itself's been around for about 8 years, but the larger part of that was actually spent just doing research. It's only been available to the public about 3.5, 4 years, and we've just been thrilled with the response.
Yeah, it's really, you know, many of the big names are coming on board saying that you need this system. So what's the cost of the program here? And of course, economically, we need to be at a profit in the dental office to make this all work. So the charge of the patient, this type of thing.
You bet. But when folks are looking about implementing the system, the first thing that I really stress is the training that comes along with it. Because with that, that's going to put all those moving parts together.
Right.
So the kit itself costs about $59 to the office.
Okay.
Now where that ends up going out the door, there's going to see a range, often between $125 and $150.
Good.
Part of that's going to be, we'll help you with that in the training. We'll look around, we'll figure out what that sweet spot is.
Right. Because every practice is different.
Absolutely, and we want you to practice the way that you see fit. There's no one size fits all. We'll customize it for you.
Great. So where do we get more information? Where do we get to learn about this and get a hold of you?
Well, we spent a lot of time developing a very content-rich website, which is just www.carifree.com.
Okay, you can probably see it right there. carifree.com. Okay.
Absolutely, you got it. So from there, you can certainly get a hold of us. One thing that's been very popular is people doing 1-hour webinars with us, one-on-one with the office. You can ask a lot of questions, help to connect those dots, and see if it'd be a good part of your caries management protocol.
Fantastic. Well, very good. Chris, thanks so much for being with us.
Thank you so much. I really appreciate it.
Appreciate it.